Hi, I'm Annie Murray. I work for the Office for Health Improvement and Disparities. I'm going to do a short presentation on joint strategic needs assessments. Apologies I can't be there in person, but if you've got any questions, please just put them in the chat and I'll try and answer them by giving written responses. Before specifically talking about joint strategic needs assessments, I just want to make the point that JSNAs are only part of the picture in terms of understanding local needs. Other sources of data that are equally as important are service data, and that's not just mental health service data, but also other relevant physical health and public health service data, for example, stop smoking, weight management and substance misuse services. Joint strategic asset assessments. So understanding both needs and assets will help identify gaps in current intervention services or programmes, and more importantly reduce the likelihood of duplication in future commission arrangements. And last but not least, community voices. This includes voices of all communities that are representative for local populations, not just those who are currently accessing mental health services, but others who might be of greater risk of having poor mental health. So what is a joint strategic needs assessment? It's a tool for systems to understand and agree the needs of all local populations and communities. Local authorities have an obligation to produce them. Integrated care partnerships have an obligation to take account of them in their plans. JSNAs are based on a local authority footprint, and obviously integrated care partnerships can cover more than one local authority. So for your area, you might have to understand more than one JSNA. The Office for Health Improvement and Disparities produces a range of fingertips profiles. In the mental health profile, it includes data for mental health and wellbeing JSNA. To get your local data using this browser, you must register, but it's easy to do. Data are organised across 6 topics: prevalence and incidence, risk factors, protective factors, well-being, which is new, services, quality and outcomes. Different indicators are available on different footprints, for example, local authorities, old CCG footprints, general practice and wards. However, not all indicators are available on all footprints. For example, income deprivation is only available on the ward footprint, while rates per 100,000 patients in GP practices in contact with mental health services is only available on a GP footprint. Mental health and wellbeing JSNA provides data, but it doesn't do the analysis. You've still got to do that yourself, or think about that yourselves, as this will need to include the other 3 elements as described in the previous slide. So, whilst each local authority has to have a JSNA, there isn't a set format. If you want to check how your local authority does theirs, you'll need to find it on their website and search JSNA. Some local authorities will have deep dives or dedicated chapters in the main JSNA or separate mini JSNAs for mental health and wellbeing. Some might have very little on mental health. If what there is old or it's not very useful for you, most local authorities have a process for adding sections and updating what they already have. If you'd like to update or add anything or do a deep dive for mental health, I'd suggest contacting your local authority public mental health team to find out how. JSNA reports can be quite long, and I've read ones that are over 100 pages long. It's a lot of information to take in, and it can be difficult to link the recommendations to the data in the report, particularly if the recommendation at the end of the report and the data is at the front. I really like Cheshire West and Chester's mental health JSNA. I like it because it gives you topic-based information, including data, some analysis and recommendations, and it's all on one PowerPoint slide, so it's really easy to see the connections between the data and the kind of ideas that you have to address some of the presenting needs. This is my final slide, and I've just put some links in here for you to kind of have a look at when you've got time. It's just to give you a sense of how different some of the JSNAs are. Thanks for listening. Thank you. Bye bye.